Hello everyone, my name is Lakin, and today I'll be talking about delirium in hospitalized patients. I chose this topic because delirium is something nurses encounter across many healthcare settings, yet it is often under-recognized or mistaken for dementia. Early identification and prevention can make a significant difference in patient outcomes. During this presentation, I'll discuss what delirium is, why it matters, common risk factors, nursing assessment, evidence-based prevention strategies, treatment, and the important role nurses play in recognizing and managing delirium. Delirium is a serious but often preventable condition that affects many hospitalized patients, especially older adults. It develops suddenly and can cause confusion, changes in attention, and altered levels of consciousness. Unfortunately, delirium is sometimes dismissed as normal aging or confused with dementia, which can delay treatment. As nurses, we spend the most time with our patients, making us the first line of defense in recognizing changes in mental status. Early intervention can reduce complications, shorten hospital stays, and improve recovery. Throughout this presentation, I'll explain why delirium deserves more attention and how nurses can help prevent it. Delirium is defined as an acute disturbance in attention, awareness, and cognition that develops over a short period of time, usually within hours to days. Unlike dementia, delirium often fluctuates throughout the day, meaning patients may appear alert one moment and confused the next. There are 3 types of delirium. Hyperactive delirium is characterized by restlessness, agitation, and sometimes hallucinations. Hypoactive delirium causes patients to become withdrawn, sleepy, or less responsive, making it the easiest type to miss. Mixed delirium includes symptoms of both hyperactive and hypoactive. Because symptoms can vary, nurses must perform frequent assessments and communicate changes with the healthcare team. Delirium and dementia share some similar symptoms, but they are very different conditions. Delirium develops suddenly, while dementia progresses gradually over months or years. Delirium usually has an underlying medical cause such as infection, medication side effects, dehydration, or surgery. Once the cause is treated, delirium is often reversible. Dementia, on the other hand, is usually caused by chronic neurodegenerative diseases and is generally irreversible. One of the biggest differences is attention. Patients experiencing delirium often have difficulty focusing or following conversations, while patients with dementia usually maintain attention until the disease progresses. Understanding these differences helps nurses identify delirium early and begin appropriate interventions. Delirium is associated with serious complications for hospitalized patients. Patients with delirium are more likely to experience falls, pressure injuries, prolonged hospital stays, functional decline, and even increased mortality. Delirium also increases healthcare costs because patients often require additional testing, closer monitoring, longer admissions, or discharge to rehabilitation or long-term care facilities. Beyond the financial impact, delirium can be frightening for patients and their families. Patients may experience fear, anxiety, hallucinations, or confusion, while family members often feel helpless as they watch these sudden changes occur. There are many factors that increase a patient's risk for developing delirium. Older adults are particularly vulnerable, especially those with dementia, multiple chronic illnesses, vision or hearing impairment, or a history of delirium. Hospital-related factors also contribute to delirium. These include infection, surgery, intensive care admissions, sleep deprivation, dehydration, electrolyte imbalances, pain, and certain medications such as opioids, benzodiazepines, and anticholinergics. Many hospitalized patients have several of these risk factors at the same time, making prevention especially important. Early recognition starts with a thorough nursing assessment. One of the most commonly used screening tools is the Confusion Assessment Method, or CAM. For critically ill patients, the CAM ICU is often used. When assessing patients, nurses should monitor for changes in orientation, attention, memory, sleep patterns, behavior, and level of consciousness. It's also important to review medications, assess pain, monitor hydration, and talk to family members who may recognize subtle changes from the patient's baseline. Because delirium symptoms fluctuate, one assessment is not enough. Ongoing observation throughout this shift is essential. The good news is that many cases of delirium can be prevented through simple, evidence-based nursing interventions. These include encouraging early mobility, promoting normal sleep patterns, keeping patients hydrated, managing pain appropriately, minimizing unnecessary medications, and providing orientation with clocks, calendars, and regular communication. Making sure patients have their glasses and hearing aids available can also reduce confusion. Family involvement is another important intervention because familiar faces help patients stay oriented and calm. These non-pharmacological strategies have consistently been shown to reduce the incidence of delirium and improve patient outcomes. When delirium occurs, the priority is identifying and treating the underlying cause. This may include treating infections, correcting electrolyte imbalances, adjusting medications, or addressing pain and dehydration. Non-pharmacologic interventions should continue throughout treatment. Medications to manage delirium should generally be reserved for patients who pose a danger to themselves or others and should not be used routinely. Nursing leadership also plays an important role. Leaders can promote delirium screening protocols, educate staff, support interdisciplinary teamwork, and encourage quality improvement initiatives that focus on prevention. Creating a culture where delirium assessments are routine can improve patient safety across the organization. Delirium affects everyone involved in a patient's care. For patients, it can be frightening and disorienting. Families often experience anxiety because they might not understand why their loved one suddenly seems so different. Nurses are responsible for recognizing early signs, implementing prevention strategies, and advocating for appropriate treatment. Physicians and advanced practice providers focus on diagnosing and treating the underlying medical causes. Hospital administrators also have an important perspective because preventing delirium improves quality measures, reduces complications, shortens hospital stays, and lowers healthcare costs. I'd like to end with a few questions for discussion. Have you cared for a patient with delirium, and what intervention seemed to work best? Why do you think delirium is still under-recognized in many hospitals despite the available screening tools? And finally, what changes could your workplace make to better prevent delirium and improve patient outcomes? For the unit I work on specifically, one would be promoting good sleep hygiene. I have noticed a lot of nurses, including me, if a patient likes to keep the room dark, we keep their blinds down and lights off, which is a huge factor in a patient developing delirium. In summary, delirium is a common but often preventable complication of hospitalization. Early recognition by nurses can reduce complications, shorten hospital stays, improve patient outcomes, and lower healthcare costs. Using evidence-based assessment tools and prevention strategies allows nurses to identify delirium sooner and intervene before patients experience serious consequences. As future nursing leaders, we all have an opportunity to improve delirium recognition and prevention within our own practice. Even small interventions like promoting sleep, encouraging mobility, and involving family members can make a meaningful difference.